go deep dive mode on the Japanese Encephalitis JE vaccine, so you have every clinical, pharmacological, and nursing-related detail you might need for nursing exams, viva, or patient education. Nashref 1. Generic name, drug class, brand name. Generic name, Japanese Encephalitis vaccine. Drug class, inactivated viral vaccine, e.g. ICRO, GVAX. Live-attenuated viral vaccine, e.g. Emojev. Brand names, ICRO, inactivated, virocell-derived, Europe, USA, Australia. Emojev, live-attenuated recombinant, Australia, Asia-Pacific. GVAX, inactivated, mouse brain-derived, older, phased out in many countries. Number 2, definition. The Japanese encephalitis vaccine is a preventive immunization that protects against Japanese encephalitis virus, JEV, a mosquito-borne flavivirus that can cause severe, potentially fatal inflammation of the brain with high rates of neurological disability among survivors. Number 3, mechanism of action. Inactivated vaccine, IRO, contains killed JEV particles grown in virocells, cannot replicate, introduces viral surface antigens to the immune system, activates B cells, production of neutralizing antibodies, activates CD4 plus helper T cells to support B cell and memory formation. Live attenuated vaccine, Emojev, genetically engineered yellow fever 17D vaccine strain expressing JEV envelope proteins. Replicates mildly in the body, stronger, long-lasting immune response. End result, development of long-lasting humoral, antibody-mediated, and cell-mediated immunity. Neutralizing antibodies bind to viral envelope proteins to block cell entry during actual exposure. Uses: routine childhood vaccination in endemic areas, Asia, Western Pacific. Pre-exposure prophylaxis for travelers staying 1 month in rural forested JE risk areas. Short-term travelers with extensive outdoor night activity in rural zones. Occupational risk, laboratory personnel, military, field workers. Indication: National Immunization Program inclusion for children in endemic countries. Adults or children traveling to or living in areas where JE is common. People working with JEV in research or diagnostic laboratories. 6. Contraindication: known hypersensitivity to previous JE vaccine dose, vaccine components, e.g. protamine sulfate and ICRO. History of anaphylaxis to related flavivirus vaccines. Acute severe febrile illness. Vaccination should be deferred. Immunocompromised patients. Avoid live vaccines unless benefits outweigh risks. Pregnancy. Live vaccine not recommended unless high exposure risk. Before taking this medicine, precautions. Medical history to inform your doctor. Severe allergic reactions to previous vaccines, immune system problems, HIV/AIDS, chemotherapy, organ transplant. Chronic neurological conditions, epilepsy, encephalitis history, pregnancy or breastfeeding, recent blood transfusion or immunoglobulin therapy. Special considerations: live-attenuated vaccines may interfere with other live vaccines, spacing needed. Inactivated vaccine can be given with other vaccines at separate injection sites. 8. How to use. Administered by trained healthcare professional in clinical setting. Inactivated vaccine RO, intramuscular injection into deltoid. Live attenuated Emojev, subcutaneous injection. Patient should be observed at least 15 minutes post-vaccination for allergic reaction. 9. Dosing information. Inactivated vaccine, adults and children 3 years, 0.5 milliliter IM on day 0 and day 28. Children 2 months, 3 years, 0.25 milliliter IM on day 0 and day 28. Booster, 1 year after primary series for ongoing exposure risk. Live attenuated Emojev, single 0.5 milliliter subcutaneous dose. Booster, after 1 to 2 years for children aged 9 months, 18 years if continued risk. Number 10, miss a dose, overdose. Miss a dose, take as soon as possible. Maintain minimum 28-day interval for inactivated vaccine series. Do not restart unless excessive delay. Consult healthcare provider. Overdose. Rare, may cause more severe local systemic reactions, swelling, fever. No specific antidote. Treat symptomatically. Number 11. Stop or avoid taking. Severe allergic reaction after first dose. Development of Guillain-Barré syndrome post-vaccination. Avoid further doses. Acute illness with high fever. Delay until recovery. 12. Side effects. Common, 1%, injection site pain, redness, swelling, fever, headache, fatigue, muscle joint aches. Uncommon, about 1%, nausea, vomiting, skin rash, urticaria. Rare but serious, Anaphylaxis, neurological disorders, e.g. encephalitis, seizures, Guillain-Barré syndrome. 13. Vital information. JE mortality 20 to 30%, neurological sequelae in 30 to 50% of survivors. No antiviral cure, vaccination plus mosquito control is best prevention. Immunity after inactivated vaccine, 1 to 6 weeks after second dose. Live vaccine, 2 to 4 weeks after first dose. Does not protect against dengue, Zika, chikungunya, or malaria. Combined with mosquito protection, DEET, nets, clothing. Number 14. Other drugs will affect immunosuppressants, steroids, cancer drugs, biologics, vaccine response. Recent blood products or immunoglobulin interfere with live vaccine efficacy. Wait till 11 months for some products. Other live vaccines space at least 4 weeks apart if not co-administered. Thank you. Have a nice day.